Hey guys, my name's Ruth. I'm a health visitor in England. Let's talk about what to expect in the postnatal visit with your health visitor. So this visit typically happens around day 10 to 12. It can go over, depending on the circumstances, but we tend to take over roughly from the midwife around that time. Let's talk about what to expect in the visit. So this visit is following on from the antenatal visit, which I filmed previously. You've probably had that already, so congratulations if your baby is here. This visit is going to be focusing more on you and baby, and with a sprinkle of talking about health promotion information. We're always going to have to talk about safe sleep, ICON, which is about well babies that cry and how to have that support around you and what to do when they're crying a lot. But ultimately, we are going to be talking to you about how you're doing and any questions you have about your baby. So let's get into it. So the things I'm going to discuss in this video, the format of the visit may take shape in a very different way. We have been trained to walk in to any situation and be able to match your needs. So we come in with an agenda, a very loose agenda of what we want to talk about. And that might go out the window if the whole visit needs to focus on feeding support or your mental health or a concern or problem that you have with your baby. These visits are here to support you. Yes, to give health promotion information, but ultimately we are here to support you and help you in these areas. So with that in mind, this stuff should be discussed at some point throughout this visit. Now, we're going to want to know how you're getting on. How was your labour? How are you feeling? Have you got any pain in your legs, any swelling? We're looking out for signs here that we may be needing to get you into hospital again to be checked, or everything's fine. That's absolutely brilliant. How's your bleeding going? How are your breasts feeling, whether you're feeding or not breastfeeding? What's your breast comfort like? These are questions you will be asked. You must also be reminded to do pelvic floor exercises. So this is your reminder now whilst you're watching this video. Whether baby is here or not, you must always be strengthening those pelvic floor muscles. We're also going to come and talk to you about your mental health, the baby blues, how you're feeling, any signs of postnatal depression, if you're feeling tearful, anxious or emotional. Some of these are very, very normal. It's the extent that these feelings can be and how long they can go on for, whether we need to start offering a bit of extra support. In England, the first 2 years after your baby has been born, you are put to the priority list of the free NHS talking therapies. So it's really worth, if you feel you are struggling with your mental health, please let your health visitor know, or you can self-refer. Your health visitor should give you the information around your mental health and what to access and where, if you feel you are suffering with mental health problems, anxiety, low mood. It's a tough time, guys. And, some of it is very, very normal, but some of it isn't, and that's where we can help you. We're also going to want to talk to you about bond and attachment. How are you feeling about your baby? I know some of you listening may think, what a silly question. Of course, I'm in love with my baby, but sometimes people don't bond immediately. We have people in our team who can come and support you with that. The hope is not lost if you are struggling to bond with your baby. This can be very normal, and there are things we can do to help with that. So please don't panic. You're not alone with those feelings. Equally, you're not alone with the feelings if you gave birth to baby and you didn't have an immediate rush of love. This can all be very, very normal, but please do talk to your health visitor about it so we can support you. We're also going to want to talk to you about how feeding is going. If you're breastfeeding, how is it? There's a checklist in the Red Book, which you should have by now, particularly at your new birth visit, that best practice is to go through to check that baby's getting enough, check that feeding's going okay for you. If you've chosen to formula feed, this is when we should be talking to you about paced bottle feeding, responsive feeding, continuing to do skin to skin, and also checking that baby is getting enough milk, that is all going well, that you know how to make a bottle, how to sterilize. I know that sounds silly, guys. Some people don't. There's no manuals with babies. We're here to help teach you these things. Let's get on to baby. So we do a slight check over baby, wanting to check their fontanelle, wanting to check their spine, wanting to check their skin, lots of things like that. We're going to weigh, measure the length of baby, and also check baby's head circumference with your permission, of course. This will be plotted in their Red Book on the centile charts. Just to remind you, these are the centile charts. Your baby will be born on a centile, and then this is just a rough indication of how they're doing for the next however many years. What we like to see is that a baby will loosely follow one of these lines. There's no right or wrong lines. Yes, if a baby shoots up or shoots down, then we may need to intervene and support you in other ways. This is just a guideline for us to see how baby is doing. A rough guideline. Following on from that, we'd like to know how wet and dirty nappies are going. How many are you getting within 24 hours? Any questions about that? You will start to become obsessed with your baby's poo for the next few years, so just get used to that. Also, we're going to want to check, have you received the results for the newborn blood screening yet? Have you received, was the audiology check okay? Is there hearing tests? Is that all passed? Usually that's done within the first couple of days after baby has been born. Have you got any concerns with baby? Any questions? Most people do. Completely normal. You can ask away. No question is a silly question. We are here to help you and answer those questions, guys. Like I touched on at the beginning, health visitors and midwives should still be talking to you about safe sleep. This is to help prevent or reduce the risk. You can't prevent, but you can prevent some cases of sudden infant death syndrome, how to reduce that risk. Also, we're going to want to talk to you about expectations of baby sleep and feeding responsively. It's quite an old-fashioned way to clock watch and think, oh, baby had a bottle 2 hours ago, I'm going to try and stretch them. We don't actually recommend that anymore. We recommend responsively feeding breast and formula-fed babies, looking and watching for the cues that your baby is hungry, even if it's half an hour after their last feed. They pass that milk very, very quickly, guys. Their tummies are absolutely tiny. They feed very little and often. And this leads me on to sleep. Some newborns wake hourly. This is normal newborn behaviour. You're doing nothing wrong. They just feed very, very frequently. Equally, on the other end of the spectrum, some newborn babies sleep for hours and hours. I will do another video on when you need to wake your baby, whether you need to wake your baby, and signs to look for if your baby has had enough milk. At this point as well, it's likely we're going to revisit health promotion information. So have you registered baby? Have you got your immunisations booked? You're going to have a 6 to 8 week GP check alongside a 6 to 8 week health visiting check. We'll likely book another visit in with you. Have you got any questions about immunisations? If I've missed anything, you will soon find out on your new birth visit, but all of this information is in your red book. I just want to follow on talking about the state of your house when we come in to visit. I don't care if you have your washing out. Frankly, I'm impressed you put your washing out. I don't care if there are dishes in the sink. I have had families who have gone to the house and it is spick and span spotless. Please, I don't want this pressure to be put on you to be worrying about cleaning your house. I would much rather walk in and see you doing skin to skin, sat on the sofa in your pajamas, hair not brushed. We are not looking for any of these types of things. Things we don't like to see is maybe rubbish piling up at the front door, things that are a bit more of a safety aspect when it comes to children. Animal poo on the floor, even animal poo out in the garden. Doesn't necessarily worry me, but it's something that we do need to be mindful of other children and their safety as well, which leads me on to pet safety. I always feel incredibly patronising when I bring this up. Of course, I know you're not going to leave your baby ever unattended with your dog. We have to say it. It is part of our job to say it, to ensure that there is safety there for your baby. Unfortunately, accidents do happen. Dogs are unpredictable. They can be the kindest pets you've ever met in your entire life. They're still unpredictable animals, and children are unpredictable as well. It's also worth mentioning here, if you didn't have an antenatal contact, we do go through something called the Family Health Needs Assessment. This is ultimately an information gathering exercise. Some people do and say they are intrusive questions, and I appreciate where that is coming from, where people are coming from when they say that. But we ask these questions in order to create a bigger picture on what support the family may need. It's not to be judgmental. It's not to think, oh, she's a single mum. It's that there are other areas we can refer you to, other support avenues to make sure that help you with this journey of having a new baby. We're going to ask in that antenatal context about who's living in the house. Do you have any other children? How's your income? Do you need any financial support? Do you need any support with bedding or for your other children, or clothes for your newborn baby, or nappies or food? Also, we do ask about domestic abuse if it is safe to do so. We will not ask you about domestic abuse if there are any other adults in the house, if there are any children over the age of 2, or if your partner is there. So please do not panic that we're going to ask you that question if your partner is there and you are in a domestic abuse situation. There is information in your red book on how to access support for that. I just want to reiterate, guys, we will be asking you about your mental health. And if you feel safe to do so, or you feel ready to do so, please do reach out to us, because we want to help you feel better. We want to help you have the best start to this baby's life for you and them, and for you to enjoy it as much as possible, because it's already a really tricky period of time. Really do lean on that support network. And if you don't have that support network, please tell us. There are agencies out there, there are places we can refer to, such as Home Start, Bernardo's, who can offer support to you in your home. Some of these people can. So please do let us know. We want to help. Like I said, there may be some things I've missed. If you have any questions, please put them in the comments. If you've liked this video, please like, subscribe, give me a follow. You can also have a look at my other social media platforms on Instagram and TikTok. My name on there is Ruth Watts HV. The HV stands for Health Visitor. Just to remind you, I have some guides. The link is in my bio. There's one on fussy eating, toilet training, how to help your baby fall asleep independently without needing them to cry, and how to handle toddler behaviour. I'm in the process of creating a guide for older babies, sleep, and also a guide for new parents, what to expect when your new baby is born. So yeah, please do give me a follow and a like. And I'm always praying to the sleep gods for every single parent out there. And remember, calmness is always your superpower.